Dr. Shiromali Dissanayake is a committed community medicine professional specializing in maternal and child health. She serves as the Social Secretary of the Menopause Society of Sri Lanka. She is a member of the National Resource Pool for Gender-Based Violence and acts as a resource person for the National Elderly Childcare Development Program and Adolescent Health. Dr. Dissanayake also contributes to the National Non-Communicable Disease Program. Moving to Dr. Dissanayake, so we would like to know what are the social impact and societal response to menopause and age-related issues.
Thank you. Actually, the menopause is a biological phenomenon which all the female are facing in one day. We have to address on this, and I think Tashan have told a lot of things about the negative aspect of that. But we have to the menopause and the physiological event we have to manage properly. If not, there will be a big problems coming, especially for the person, and again after that to the close family members also. The one thing is actually menopause is in Sri Lanka, the knowledge dissemination is very less, and there's no grassroots level proper program is going on like other programs. I will discuss in my next question. And because of that, the female who is going to have menopause is mostly doesn't know anything about menopause and what are the signs and symptoms of menopause and what are the outcomes and how she's going to overcome these issues. Are there any prior things that she can do to minimize the effects on that? So those are the big problems with our society at the moment. So if she knows all these things, she's prepared for these, and then she's ready for the menopause, and that will be the very happy life of her. Actually, the last third of her life, she will be very happy. But the problem is, since she doesn't know anything about it, her family member doesn't know anything about it, so there will be a big problem. For example, as Darshana said, aches and pains are the main problem in our country, but no one knows that is due to menopause. When you organize some kind of a medical program, the most of the female are coming with aches and pains, and the other complaint is they can't work now as earlier. They are not active. So those are the things, and we also frustrated because we are always writing the drugs for the aches and pains, nothing else. So, but behind this is menopause. So we have to know about it. And the other one, for example, another one is the hot flushes, I'd say the third cause. What will happen when she feels those things, like everything, she's embarrassing, and she can't work properly as earlier, and these issues will help make the problem for the others also. For example, very rainy cool night, she is going to switch on the fan and the AC, and the partner have to tolerate these things. So sometimes what will happen, if he doesn't know anything about this, so there will be small arguments going on. Every day she is facing this problem, and her husband also facing this problem. So without understanding this issue, there will be a big problem with the time. So they don't cooperate every day, the same thing. What will happen next day? And the whole night both of them were awake. And next day, how can they work? As a mother, as a wife, she have big role to do it at her home. So if she can't do this work, so the family member, husband and the immediate family members, children are affected. What will happen? The next day morning, the children miss their school buses. They go to the work very late. So there are so many things happening because the wife is the key role at home. Imagine how, if she's working, so she have to do her work at home, and then she rush to her workplace. What will happen? The single one symptoms is make everything very bad. She can't work at workplace also efficiently like other days. So, and she will be blacklisted and she will be scolded at workplace, and the team also scolding because the outcome is a team effect. So if she is not working, sometimes the others also can't do their work. So finally the outcome is very bad. And the economy, the workplace, there are so many problems. So every day, if she is not treating, if she is not identified this problem and get it treated, finally she will be chased out from the workplace. What will happen to the economy of her family life? So this is a vicious cycle going on and again and again. Even in the working place also, if that environment is not suit for her, this problem is going again and again. So there will be big problem. Finally, these outcomes come to the country also. So country also economically in two ways. It's because the productivity is going down, because at the moment 60% of the females are in this age group 40 to 60 years. So the big amount is there. Workforce is very much higher in this age group. So because of that, the outcome is also getting low. And the other hand, if you are not identifying these issues, I mean osteoporosis and things, also then you get the fractures and NCD also. There are so many comorbidities and all these things. If you not identify, then the health seeking is very high, and the health expenditures also getting higher and higher. So we can identify these things very early and do. There are so many things to do. Mainly the awareness itself can do a lot of things. If you can do some intervention in the early stage of menopause, there will be a big outcome as well.
Since we have concluded talking about the services we have for menopausal women, do we have how have the government addressed age-related issues at society level in Sri Lanka?
Actually, the government in health ministry, there's a directorate for the elderly care, youth, elderly and the disabled. So there are programs going on, but they are mostly about in a administratively, such as development of national policies and the preparing of guidelines and circulars for maintain the curative and the care centers and health grassroots health level to streamline the programs going on. And there are some programs they are preparing for some curriculum revision curriculum for the postgraduate educational things for the undergraduates and the postgraduate medical officer medical career, as well as the primary health care staff and the hospital staff. Those are the things mainly they are doing, and some they are also conducting some national steering committee and some technical advisory committee. Those things are there maintained by the directorate, and there are some communication with the partnership with the NCD also now, because there's another directorate for the non-communicable diseases, so they have hand in hand, they do some work. Those are the things normally having. Actually, have to say, not like the other programs like child welfare and maternal care, there's no uniform disseminated program is going on for the elders. At the moment, there is one program is going, there's no program for the community-based level. Most of things, but at the moment, there's a JICA projects going on, started on 2022 and start going till next year. That program, of course, very good, and it's very that's in the grassroots level, in the community-based program. They have selected 4 areas, 2 areas in Colombo, Paduk and some other place where it's in Horan or something. And the other one is 2 areas in Badul, and those areas they do a lot of work. They have a center for the elders, and they are get them to the center it's like a daycare center who comes in the morning, and they spend their life whole day at that place, and they share their work and their ideas and things, and they sometimes there are some programs going on to earn some money for them also. For example, they make some handicraft, some are making some bags, paper bags. So like that, they are helping the people to do some work, and with the AGA office staff, they try to get some money. They have some form of platform to sell those things and get some incentive for the elders. So that's a good program is going on. That program is ending on next year, but it's still a pilot project. I hope that with the results of that, they can disseminate for the country. Other than that, there's no community-based programs going on for the elders. So those are the problems with the elders at the moment. So we think we have to do something. We have to prepare good work with the help of, the ministry have to disseminate those things and get it arranged. But the problem is, and there's another directorate for the non-communicable diseases, HLC program that is based on all the base hospitals and some rural hospitals also and districts also. That is, I mean, there's a monitoring is there, the daily, I mean, they evaluate everything annually. So their program is going on. But the problem, the female participant, it's good. I mean, fairly good, but the male participation is very less. So today also I discussed with directorate where they said that is the problem, how to get this male. So I asked whether when you are next year, when you are finishing this community-based program, are you going to disseminate it? Problem is how to get the male. If you can give a bottle of Arak, they definitely will come. So that's the problem. How to get the males? It's a one problem. And the other thing is, though the females come to the NCD clinics, the HLC clinics, you can't cover everything. I mean, there's certain things have covered. Some, for the example, they do cervical cancers. They screen the basic screen for the breast and cervical cancers, and then they screen for the diabetes, hypertension, and ischemic heart disease and the obesity. Those are the only things can do there. So there are so many things you have to see. The dementia, as she said, there are so many repercussions coming with the dementia in future. Still now also we have so many issues with the dementia, the person itself and the family members also suffering with that. So there's a big issue is there. The osteoporosis is another big problem. So those things are not screening, but there are so many things to be screened, and the mental health. There are so many issues with the psychological issues. So those things have not addressed yet in those clinics also. So we have to do some, especially if we can, I mean, for the females, we can some this middle life clinics in the hospitals. And then we can do something because it's a multisectoral thing, and if you can refer there, and then normally we plan to do it on base hospital upwards. So there are consultants for the different disabilities. So we can refer them from there. We can do the screening, and then if we can refer them to the specialized place according to that. So I think start these things very soon, because that's a big problem in future. The elderly population going up and up. And the other thing, the one thing I tell is, those days, as I think Darshan started, our grandmother and grandfather is looking, I mean, that's to by the grandchildren and children. But the problem is now they are alone. They are alone at home. Their children is not there. They are away. Most of them are in abroad now. All young people are going up. So we have to see how we are going to look after these aged people. So we have to have a good plan and do something very quickly.
So moving on to our Dr. Dissanayake again, how are we going to educate the society and family to embrace menopause in a positive manner?
Actually, the menopause is a blessing, according to my opinion, because normally menopause start around, so she'll be 1/3 of her life is on this stage, and at that time she's already menopaused and she's not bleeding, and so she does, so she can wear anything, whatever the thing she can wear, because earlier she have to think what's going, when she going somewhere she have to get something, and there's no contraception to be used now, so she can enjoy her life very much rather than the earlier. And again she's now mature, so she can take good decisions, not like earlier. So, and she have, I mean, she can go anywhere, she's have more freedom, and most of the time the family is completed and children are big, and so she don't have to spend much with the family, so she have more freedom, so she can spend time with her own herself. So, and she has some money also. When you compare with young age group, she had earned something, and otherwise she know how to earn, so she have some money, so she enjoy menopause life in a good way if she cope up with these symptoms and signs of the menopause. So to have a good life in last decade of her life, so we have to, she have to do lot of things, as well as her family members have help her to enjoy herself, and the society also. For that, I think the family members also have to know these symptoms, as I told earlier, and aware about these symptoms. Then the family members can help her to overcome these problems. For that, I think think the best person is public health midwife, because we have a good network in the grassroots level. She is going home to home and discuss with every people. I mean all the people in this house about the child care and the maternal care. So why can't she discuss with the person who is there, the grandmother? Also she can discuss. Normally she meet those people also. So she can drop on the each house where this age group is available, and she can discuss these issues with herself again with the family members also, and she can address on that level and discuss, settle the problems. So that is the best thing I think we can do in grass, because already we have that network. Only thing is then the population is very high, getting high for that midwife. Then we have to think about that, how you are going to minimize the workload of the PHM, because she can do the 24 hours. So minimize and give some incentive or some promotion and things. They can do a lot of things. So that is the best thing. On the other hand, for the society level, most of things are, I think, overlapping. Darshan has told already. The one thing is educating the school children. He told about the teachers. I want to tell about sensitization of the children also. We need, that's a big theme, because all children are in the family members. So if you are sensitizing them in school level, then the message is going with them to the house, and they know how to care their mother and the grandmother. So they help them. So so we have to sensitize them, and also we have to get them to the school curriculum as well as the exam also, because these days if you are not the question to the exam, they never think about it. So I think you have to put in the exam also as well as the school curriculum. So the children all are getting the menopause issues to the mind, and they will help the family member. The other thing is, one that we can do a lot of things. Do some awareness program in the work environment sector. So at the moment also, Menopause Society is doing that. There are some leading companies are with us, join with us and getting that knowledge from us, and so we have to sensitize the workforce as well as the administrative level. Then you can have a good environment for the workplace. If some workers have some problems, they can discuss with them. And sometimes there are workers who are suffering with these issues, and because of that they are getting, their work is less and they are getting blamed, but they don't come out with these issues because of these our cultural issues and things. They don't want to expose themselves. So if the administrative level are sensitized on that, these people will come out with their problems. And there are most of these workplaces, there are health center. So these health centers, we can make it menopause friendly health centers. So then they can come there and they can discuss with those issues with the person who they are, the nurse or the PHI or someone who the person is there. That's another thing that we can do when you continuously get in leave, or then we can analyze these things, why she is get this leave, and don't think about it in an individual base. This fellow is getting so many leave, but see how these things happen in them, because the teamwork is getting less and the outcome also getting very badly affected with that. So we have to think those things, and in the workplaces we have to analyze all these things and correct there itself. I think the workforce will come, the work outcome will come better. That's one thing. Again, what I thought is the media. The media already, Darshan told, that's the best thing these days, because you can reach the next end, because so they are that all. But the problem is in the media, the air time and things very difficult to get it. But if the government is helping, they give some promotional things, and if support, sometimes the national media levels you can get some support, and it can be the media also can be just a small narration or to a video, or sometimes you can make a teledrama based on this type of a story, even a film. So these things are good. I mean, you can spend the money on that way, and we are giving a message because there are so many stories behind in our society. We can sensitize those things. So that's the one thing. And the other thing is social media. I want to emphasize social media platform also very place to get the support and the sensitize the society. So it helps to answer the questions for the people, I mean the person who is suffering these things, as well as the society also. And another one more thing I want to tell is the small group. It's a very good thing if you can make it. Preparing small group in the village level. It can based on the public health midwife level with the support of the GN, Grama Niladhari, and the division secretarial office. Also there's a person who is the social worker is there, so you can get the support of them also and make a small menopausal club like thing. For example, you can put a nice name like Mihiri Madivya Club or something. So we can make it something like, so with there you can make some recreational things there, share their knowledge and the issues and exercises, all these things.